that more than 5 billion doses of tranquilizers were prescribed last year, that an estimated 8 million Americans have ulcers. It is also true that approximately 25 million Americans have high blood pressure, and that 1 out of every 5 men will have a heart attack before the age of 60. These statistics are attributed to our body's mental, physical, and chemical reactions to unsettling demands and experiences. These statistics represent the effects of stress that are present in our lives. Hello, I'm Carl Gronberg, pastor of Gethsemane Lutheran Church. Today we'll discuss stress, what it is, what are the symptoms of stress, and most importantly, how we can cope with stress and help others to cope with stress. With me today is Chuck Meyer, chaplain, St. David's Community Hospital, Trish Merrill, an educator from the Faulkner Center, and also Reverend Bob Bryan, director of the New Life Institute. Welcome, you three, and thank you for being with me. Let's start right at the top. What is stress? Chuck, what do you say? What is stress?
Well, as I think we'll all be in agreement, stress is one's reaction to any kind of change. And the place I see that, of course, is at St. David's Hospital, with people coming in with either traumatic illnesses or acute or long-term illnesses. Illness itself is very stressful, and it's sort of a circular argument, which comes first, the illness or the stress. Some people argue that stress causes illness and is a major factor in producing illness. So we see people when they've come in, and it may be as a result of stress, and then even more stress is added on to that once they're in the hospital.
Stress is an experience that they encounter when they come into where you are, where you minister.
You bet.
The hospital situation.
That's right.
Trish, how do you define stress?
Well, when people come to the Faulkner Center, they've been under a lot of stress, and many times they've tried to handle that stress, the uncomfortable feelings that they have, or the emotional pain or whatever, by drinking or drugging to feel better, to escape. And for many people, they're susceptible to becoming addicted to drugs and alcohol, and that adds another level of stress to a family. And so when we see people come in reaching out for help, they're very stressed. Sometimes, though, as they move through with the help and begin to get some counseling, the stress goes down a little bit, because stress can be caused by not knowing what's happening to you, not knowing what's happening to your family. And as you begin to be able to name what's happening, then the stress level can go down a little bit.
Stress is a reaction to experiences in life. It's a reaction to pressures that are upon us, to alcohol and drugs, or are they a result of the stress? Is stress something that happens to us prior to the alcohol and the drugs, or is that something that's all tied together? Is stress a feeling then, I guess I'm asking? Is it something that comes from outside of us, or is it something inside of us?
Well, I think it can come from both inside and outside. I think there are external stresses, things that happen in life, changes, illnesses, moves, etc. Then I think there are stresses that we live with internally, maybe having to do with brokenness and pain from our past, from our families of origin, things that we keep to ourselves. So it can be both internal, I think, and external.
Bob, how about you? What's stress? How do you define it?
Well, Carl, New Life Institute is a place where we do with counseling and with education. It's a Methodist program to deal with that. And so I'm constantly involved in people's families and in individuals and in couples. And stress, to pick up on what was just said by Trish, stress often comes out of the family system, the way the family is constructed and the way that family then responds to events that happen around them. Some of those events are celebrated in joyous ways, but the same events in another family can be a very stressful kind of occasion. Common events that create stress, certainly clearly for everybody, are things like divorce, things like death, things like job loss. Children often are acting out, they're teenagers acting out behavior like a lot of times reflects the stress that's in the family that the family itself can't deal with or talk about. So the kid's acting it out on behalf of the family.
Okay, I want to pursue that a little bit, but Bob, death, divorce, job loss, those types of experiences, they strike me as being negative. I don't want those in my life.
Of course.
I don't want to face up to those. But is stress always negative? Is there some time that stress is positive? Do we need stress in our lives? Is
Well,
that
none of
something-
us can work without stress. It's part of the given of being. And we can use some stress in a creative way, such as meeting a particular deadline and drawing some juice to get that deadline met. Sometimes stress will draw adrenaline into our system and enable us to perform in some somewhat extraordinary way. So I think there are a lot of ways in which it can be positive, but fundamentally it just flows around in our life in a destructive way.
I could ask you something else, though, Carl, and that is that when you say, Bob, too, that stress is also a reaction to positive things that occur in our lives, not just to negative things like illness, death, divorce, loss of a job, but also getting married, having a baby, getting a new house, getting a new job, moving to a new city, are
Being
also
promoted or anything.
are also often as equally stressful as the negative things in people's lives.
So those are dimensions of stress also. That stress is a part of life.
That's right.
It goes along with being alive. And it's how we deal with the stress and the situation we find ourselves in. Chuck, what are some of the symptoms, if you will, of stress as you see them in a hospital setting?
Well, they're fairly standard. We see, of course, we see a lot of cardiac patients coming in with chest pain, high blood pressure. Things that occur are there's an increase in, of course, your adrenaline level, increase in cholesterol in the bloodstream, blood sugar goes up, perspiration increases. All of those things occur when we're under stress.
Is stress a phenomenon of our society, of the U.S. culture, or is this something other cultures experience also? Is it something just of a highly technological society like we have, or is it true that other societies, I know, Chuck, you travel a lot, and Trish, I guess you've done some traveling also. What do you read and what do you hear about it? Is that something that other people, other cultures deal with like we have to?
I think, yeah, I think it's true in any culture. Other cultures have different ways of dealing with it. They have different lifestyles. The Europeans, as you know, close up shop at 12 and open up at 2, or close up at 2 and don't open till 5, and every day. I think we're crazy for taking 2 weeks out of the year vacation when almost everybody in Europe gets 4.
4 weeks, yeah. I was
Really
amazed when we were in
different lifestyles.
Scandinavia just last month, and it was interesting to note how the postal system, and I wanted to get some cards back over here to the States, and a friend with whom we were visiting, he said, Carl, you're just not going to get them to go. Once it gets to be 5 o'clock on Friday afternoon, they shut down. They're done for it. And maybe that's something that we can learn from other lifestyles, is how to deal in this
Setting
area.
limits is real important, and that's one of the issues that I see with ill people who come in largely as a result of stress-related illnesses, is they have not learned or not been willing to set limits. It's a word in the English language that not many people use very often, and if you force your mouth to say it, it'll go no.
When you're invited to participate in something and say, no, I have to take care of me.
Yeah, it's important to take care of me.
I also think we live in a very competitive society where you've got to win, you've got to be on top, you've got to have the most. And I think a lot of people succumb to self-medication because of that kind of stress.
What do you mean self-medication? What do you mean?
Drinking or drugging, trying to reduce their level of stress or their anxiety by taking a chemical that will help them. I also think that we live in a society where there's this kind of myth that everybody can get ahead, and there's a real focus on the individual instead of community. And we see, as we work with people at the Faulkner Center, that you've got to help people get support from other people, be able to share their feelings, their lostness, be able to talk about what's really going on inside of them, and gain support and love and touch from other people so they feel connected.
That whole idea of community and networking is so important in a lot of the discussions that we've had on this program on Austin Faith Dialogue. And I'd like to come back to that, because to hear you talk about Faulkner Center and saying that about what you do there, I would think that probably St. David's Community Hospital has the same type of goal. And Bob, what about New Life Institute? What about that idea that Trish has held up in front of us, that we have a lot of this individuality, and that causes this, or adds to maybe the negative factor of stress in our lives?
Well, no question, the push to achieve and to be out on top creates incredible stress. Some people can manage it, many people can't. And as that goes along, they tend to be individuals. They can't show that they're having problems with that to anyone, because that's going to be remembered somewhere in the promotional system, and we're not going to be able to get ahead. People that come into me sometimes don't want to use the very insurance that's provided to help them, because that insurance will have a record somewhere, and somebody will look that they one time went to a psychiatrist for help, and they must therefore be vulnerable and sick. So they're not going to make themselves vulnerable to people's help. I grew up as a person, for example, in my own lifestyle, not sharing my feelings, holding everything in, being strong. That was the mandate I got out of my family. And it's a payoff mandate in one environment, namely in the work scene, for a while at least, but it's certainly not a payoff in the family, and it's not a payoff in the community, and I'm cheating myself out of a whole bunch of nurture that could be available to me if I were able to open up and ask for help, or seek community, or admit some feelings of pain and stress.
How do you help people who come to your New Life Institute to tie into that idea? Where do you point them in terms of community and having that support and that nurturing that I sense is really necessary to be able to function and operate in this society? I was saying to Trish today, I don't know that parish pastors can do this type of thing. They've got enough things going on in their lives. What do we do in order to be able to point people who comes in and they're obviously stressed out? What do we do to help them become persons who are able to deal with this?
By the way, I'm going to put a little plug right in here, because late in November, 17th and 18th of November, we're having a fellow, Edwin Friedman, a family therapist, rabbi from Washington, D.C., come down here to deal with pastors about the very issue you're talking about. How their family, the church's family, the synagogue's family, and all of that gets interactive, and stress gets to be, you know, running sky high. And how can they sort that out and deal with the overlappings of it? But the point I think you're making is, how do we help? First is to help the person recognize what's happening inside of them. And come be aware that where it came from, how it came out of their family system, how the family taught them certain ways of dealing with stress or not dealing with stress, zippering it up, holding it in, or opening it up and talking about it. What was valued in that family?
Right.
Encouraging them to deal with that in the family scene that they're in, and to deal with it in the other communities, the school, the church. Use those opportunities
and to affirm the person's right to be where they are. Not to take away from them their right to be, but rather allow them to see that what they're feeling and experiencing is a part of life.
Sure.
Chuck, what about in the hospital situation? People come in. Hospitals are scary places. Is that okay to say?
Sure they are.
I
yes.
think
Sure they
you know,
are.
I haven't gone in there as a patient, but I visit there regularly, and they're pretty scary places.
Sure.
So the level of anxiety, the stress is pretty high. How do you deal with people? How do you help them who come into St. David's?
Well, we deal with them all the way from the first person they meet at the door in the patient registration department, trying to put people at ease and helping them to realize we're going to take good care of you here, and it's safe here, and you'll be all right, hopefully, with us, and we'll take good care of you here. So it's a matter of putting people at ease, and then as we get particular disease groups of folks in the hospital, we do stress management classes for the cardiopulmonary patients, for the diabetic patients, for pain management, eating disorders, all of those programs. We teach stress management as a component of each of those programs.
What's stress management? What are some of the parts of stress management? What do you teach people?
First of all, as Bob said, to help them be aware of what the stresses are. And then there are techniques, the diaphragmatic breathing, belly breathing, that you can help people to learn to do. And practice. It's stuff that really takes practice. The chaplains are the ones that lead the stress management classes in cardiopulmonary and in the diabetes departments. And we also have a class that we teach on religion and pain, religion and eating disorders, religion and, because I think our faith groups also have something to say about stress. I mean,
I hope so.
God does not say, by the way, if y'all aren't busy on Sunday, take a day off. It's a commandment. We're commanded to rest. It's as though God knows what's good for us and says, you're commanded to keep the Sabbath holy and to work rest into your schedule. It's wonderful if we pay attention to our faith.
So as chaplains there at St. David's, then, one of the things that you want to try to do is tell those patients, let's look at the way we've been living our lives and how can we go about managing all of this differently. You know, I think it's an interesting statistic that I started at the top of the program. About 1 in 5 men before the age of 60 will have a heart attack.
Yeah.
What does that say to you?
Breathe deeply. Yeah.
Make sure that you breathe deeply and also...
And manage stress, and awareness really for me is the key to stress management. If I'm aware of my behavior, aware of my beliefs, aware of my diet and exercise program, those are the ways really, if I want to manage my stress level, I can. The interesting thing to me is every stress class I teach, I ask people what stress is and how do you manage it, and they have the answer to that. They know what stress is, they know where it is, they know when they feel it, they know where they feel it, and they know what to do about it, and then they don't do it.
Mm-hmm.
So it's curious to me then to ask, what's in it for me not to manage my stress?
Mm-hmm.
What am I getting? What's the secondary gain in that? And then to see if I'm willing to make some lifestyle changes, minimal, really watching diet and exercise, to do something to speak to that.
I think that's a very interesting point I'd like to come back to, is what do I get out of this? You know, what is the gain? And that whole idea, which is a topic in itself, is the worth that I experience as a person, what I am worth, and how I'm going to take charge of my life in that sense so that I can give evidence that I feel I have some worth and value. Trish, Faulkner Center, let's talk a little bit about what you deal with people and who are coming in with that stress, and like on to what Chuck is saying, you try to help them begin to manage their lives. Is that what they do there?
Yes, education probably is one of the key factors in helping people learn what has happened to them, what is going on, how it has affected their family. Therapy, both on an individual basis and in a group basis. A very, very important part of what we do has to do with the 12 steps of recovery of Alcoholics Anonymous that are also applicable.
Trish, I've heard the term dysfunctional and codependent, those types of terms. What is a dysfunctional family? What does that mean? When I think Bob mentioned about the family unit being tied up in all of this and the stress, and that we don't live in isolation, but what I heard him saying is we live in relationships, and stress is a part of where we are in terms of our living. What does that mean, dysfunctional family?
Well, what it means is if you're living with someone who's got a major problem, an illness, a disease like alcoholism, something wrong, and you stay in relationship to that person and adapt yourself around that illness or disease without reaching out for help, then sooner or later you come up with maladaptive kind of behaviors. In fact, I was thinking when you're talking about stress, stress finally for many families gets heavy enough that they actually reach out for help. It's the crisis that causes somebody to reach out, when what we wish would happen would be earlier, that the little stresses would help people begin to ask the question, you know, where do I go for help? How do I deal with this situation?
What do people who are watching the program, who represent faith communities throughout Austin, what do they do in terms of reaching out? Where do they go? What if they notice that somebody in the family, or what if they themselves? What if I recognize that I have symptoms of alcoholism? Where do I go? Do I go to my rabbi? Do I go to my pastor? And then they say, have you checked out the Faulkner Center? What are some of the steps that can help people who are watching this program so that they can find some of those resources that you're talking about? I can feel pretty lonely and isolated, Trish, out there. And I want that, I know that, but I'm not a religious person. And I don't know how to go about doing that. I may not have a membership in any parish or synagogue. And where do I go? What do I do?
Well, of course, it's good for people to reach out directly and just call the Faulkner Center and ask for help, because there's lots of different kinds of help there, not just for people who are dependent, but maybe people who are beginning to experience abuse, or who have been dealing with a father who is alcoholic and that sort of thing. Part of what I do with the Faulkner Center, though, is train groups of people within congregations to be more sensitive about this illness, and then do lots of education in congregations so that people do begin to feel free to ask for help when they need it, to reduce the stigma of this disease called chemical dependency.
You know, we're talking really as adults. It came to me that we're 4 adults sitting here, and I'm thinking there are a lot of adults watching this program, but that may be faulty thinking. They're going to be youth watching. I told you before we came on that I said to our 11-year-old when he came home today from his baritone lesson, I said, Erika, do you have stress? And he said, you bet, Dad. He just gotten out of his baritone lesson. And the 14-year-old came in, and David, I said, do you have stress? And he said, yeah, you know, I just left high school. What about this type of reality for children? In the Faulkner Center, St. David's, New Life Institute, you deal only with adults, or do you deal also with family units, with children? What's the experience that you have, Bob?
Well, just think in the family, say the family that you grew up in, the family I grew up in, when it came to a stressful moment, how did the family cope? Did the family reach for some, as Tricia said, some substance to throw in there to bridge over that? Did the family go into craziness? Or did the family just buckle down and work themselves through that stressful circumstance on to the other side? Was the stressful circumstance openly acknowledged by the family? Did everybody participate in it? Or did Dad suffer through it in silence in some far-off place?
Okay, I hear you say two things. First of all, did the family decide to buckle down and see it on through?
Right.
All right. And then I also hear, is that stress is it having to be done in the family individually, or is the family...
Is the whole family participant in trying to understand what the issue is? I had a 15-year-old girl come talking to me the other day. She said, I came home and there was a for sale sign out in the front yard. Nobody told me that we were going to sell the house.
Right.
She was not involved in the family discourse about the stress of moving to another place. Something was suddenly plunked in there.
Yes.
That says this family is not functioning in its most effective way. And those are the kind of people who are going to find some shortcuts. And the shortcuts are often dangerous because they get to be sometimes habit forming. Shortcuts of using substance to throw in. Or we can lean too heavily on a person instead of coping with this kind of ourselves. We talked about being in relationship, that's important, but we can also make a relationship an addiction.
Right. That's that codependency thing, right, Trish, that we were talking about before, that we can recognize that something's going on. Something isn't right, it doesn't feel right, the manifestation, something isn't right, but I'm going to become codependent on that person, that other individual. You've given us a couple clues on what we can do. Is we can see it through together as a unity. We can talk with one another. What else? Open it up.
I want to follow through just on what Chuck was saying and put it in a sharper function, which it's clear, but it needs to be emphasized. We as individuals can deal with stress by thinking in a triangular form. One side of that triangle is vigorous physical exercise. Every day we need to get 20 or 30 minutes of vigorous physical exercise in some way.
Every day?
Every day.
Wow.
Some of us may not be able to do it in one form, but we can find a form. If we can't find one, we can consult and find one. The second side of that triangle is diet. That's what Chuck said. We need to be careful about the food we put in, because some foods, particularly those high in sugar and salt, are stressors, and they're going to create stress. The third side is the spiritual, and that means we're in effect turning our life over to the Supreme Being. And that doesn't mean just words we're saying, as you well know. It's an existential journey of turning loose. And it's hard for anybody to really assume, I can turn this over to something or some force.
And can they assume that by themselves? That's where the community
not.
comes in, right?
Of course
That's
not.
where the New Life Institute, Faulkner Center, St. David's Community Hospital, and the local synagogue and the local place of worship helps. So in Austin Faith Dialogue, we're saying to people, exercise, watch your diet, but don't forget that third component either, that spirituality on that journey.
A major
Chuck?
part of that for me is modeling, role modeling. I talk to a lot of adults that, and I do also do stress management classes for high schools and junior high schools.
Interesting.
And talk to classes. And I hear the adults saying, well, I don't have time to manage my stress. Well, if I don't, then what am I modeling for my kids? What kind of modeling am I passing along to them for dealing with stress if I don't take care of me? Because that's what they're going to see. And churches as well. I mean, the churches have to model that behavior, I think, as witness to ways to
That's a
handle
program I'd like to do, how congregations and synagogues can model for their people how to take care of themselves. Trish, you were going to jump in.
Well, I think we have to accept that we are, as human beings, are not perfect, and that we'll have problems in our lives. And that if the church or congregation can realize that families have problems, and that probably the most important modeling you can do is when you have a problem, reach out, get some help.
Recognize the problem. Start there, that's a part of life. And I think that's one of the themes that we started with. Stress is a part of life, and we have to face that. And it has both positive and negative dimensions to it. And we've also looked at the fact that how we deal with it, how we cope with stress, says something about us, and maybe about the resources that we sense. And I'd like to say how we feel in terms of our own value as persons. How about kind of wrapping it up? Chuck, what about stress in your life. No, in the life.
It just went up a little bit. Good, thank you, Carl.
In terms of the people you deal with at St. David's Hospital, is there something you could say to them that you'd want to share with those people?
Oh, gee, in some way to affirm that, as we've all said, we're imperfect. It's okay to be imperfect. We're scared often at illness, at the consequences of illness, and that it's okay to feel that scare and express it and to reach out and accept help.
Thanks. Trish?
I think a lot of stress comes from hanging on to the past or worrying about the future. And I think it helps when you can be present today and live a day at a time and live out of gratitude instead of a sense of entitlement.
Thanks. Bob?
I guess what I'd talk about is self-esteem.
You bet.
So many folks come these days out of families, myself included, where I didn't get that vein of self-esteem really established in myself. And I need to have it there and not be dependent on other people around me to make me feel good.
And I think the
can have-
religious community has something to say to you
Yeah.
about that, exactly. Thanks, you three. Chuck, Trish, Bob. Today we've learned to recognize some of the symptoms of stress. And we've been introduced to ways to reduce instances of stress in our own lives. Please take care of yourself, not to become one of the statistics of stress-related illness. I want to thank St. David's Community Hospital, the Faulkner Center, and the New Life Institute for allowing these three individuals to come and be with us today. Join us again next week for Austin Faith Dialogue when we discuss the Muslim faith. And on behalf of the Austin Area Conference of Churches, I'm Carl Gronberg. Until next time, shalom.